Bismillahirrahmanirrahim. Assalamu alaikum. I hope my voice is clear. Okay, can we start, inshallah? Okay, Bismillah ar-Rahman ar-Rahim. Assalamu alaikum, everyone. This is Nasreen, lactation specialist, childbirth educator, a doula, and a lactation consultant, and a volunteer at the Breastfeeding Society in Sharjah. I would like to thank really Breastfeeding Friends again and again for inviting me for talking about this topic, where we're celebrating the National Breastfeeding Week in the UAE. We have done the same topic in the last few weeks in Arabic, and we had very good feedback, so we are doing it again in English. Well, we need to increase the awareness of the health of the woman before pregnancy, and how does it really relate it to breastfeeding itself, because we need to make sure that we're thinking more holistically, or let's say out of the box, not everything direct to breastfeeding, whatever surrounds the baby and the mother and the family, again, in regards to protect breastfeeding. As we know, for each year we have a different themes for breastfeeding, nationally or internationally. So this year we will have, or we have already, the breastfeeding is a shared responsibility, which means that everyone in the community, or everyone from the responsible people in each country, have the connection to work together to have policies or strategies, or any types of support for the women to have their best right to start, or even the baby to have the right for the best nutrition, which is breastfeeding, or even temporary alternative for any medical reasons. So basically today, it's more of like lecturing and interaction. It's just we want to make sure that all the attendee or the women's joining our session is to know that we need to make sure that to increase the awareness of regards women's health before pregnancy. We still lack this in the Arabic society. If we go to the Western part, we can still have more awareness in regards of preparing for pregnancy before they get the first baby in their family planning, or sometimes even between the first and the second baby, they still have these sorts of getting awareness and checking the mother's or the woman's health. But in our society, we still lack of that, and we will see these culture aspects, or let's say differences in how we think in each culture. At the same time, what is the positive things, or what are the negative things in each of the culture. So we will be talking about the importance generally about the specific, or in general, investigations are blood tests that we really need them before pregnancy, actually, not even during pregnancy. It's very important. Um, um, and also, we would love to talk about the family history. Very rare that anyone who gets married, or let's say couples who get married, they think about the family history. They just think about their current, getting, baby as soon as they really get the chance of after marriage. Genetic diseases also, it's very important, the genetic health diseases and the medical background regarding that. Mineral and vitamin levels, again, there's a lots of gap between filling the awareness and the knowledge of the mother of what her mineral, or let's say vitamin levels, or whatever types of blood test is really lacking in her body. So it's very important that she really gets this checkup before pregnancy, or even follow it during pregnancy, and also correct them with any food deficiencies or any food element deficiencies, which is very important. Now, as an introduction, before I want to start with this introduction, I would love to see the chat box. I want to know, which country do you come from? I need to know your nationalities. I know we have so many staying in UAE, so I need to know how many cultures, because we might ask some questions culture related to this topic, which is going to be very interesting. Okay, I need to know in the chat box. Okay, Belgium. Yes, hi Julie. Thanks for attending. Okay, and UAE living. Okay, Indian. Okay, Dina. How are you, Dina? Thanks a lot. I'm trying to catch the chat. 1 second, ladies. Okay. UAE Indian. Anyone else wants to join? I need to see how many of our Mediterranean culture, or the Arab cultures. Canadian. Thanks, Yusra. Well done. Seeing you again. South Africa. I think someone from South Africa. Okay, I'm doing well. Thank you, Dina. Okay, who's else? Any Arabs other than me? I think Yusra is belong to Arab culture, I think, right? Okay. Okay, let's see if we can get another answer. I have also Filipina lady sitting next to me, joining me. physically, and an Indian sister joining me physically. Okay, yes, I know you're Lebanese. Welcome. Okay, I will be getting this enough feedbacks. Thank you. So what we will see actually here is the different cultures and how they think of preparing the pregnancy, or they think or they don't think. What happens actually, most of the family planning or planning for pregnancy is a woman-related things where the husband is not involved in many cultures, or sometimes it's more of like female topic, and once she gets pregnant, she just want to know if she's able to get that pregnancy very soon in some cultures, or they delay it for some reasons. We'll get to that, to this also. So it's a more of like a female topic, or a secret sometimes, where the female topics are discussed in the female culture rather than a male, in a matter of couples or husband and wife. And also in some cultures, it is an innate phase where they don't just think of family planning. They think it's natural. She gets married, she gets her first baby, then she gets her second baby, which is something, it's natural. They don't need to plan for that. They don't want to do any checkups or pre-checkups or even pre-pregnancy, healthy status. And another thing which we want to make sure in our culture, and I think Yusra will think of this to support me, some of our culture, Arabs mainly, not all of them, but it differs from country to a country, and inside the country, if it's like, let's say, the cities or the villages or some of the other rural parts, where they still have that urgency of thinking that the early couples, they plan, like, let's say they got the first baby very early after their honeymoon. Okay, that is a sign that they're healthy, which means if I get my marriage last week, I should really conceive by the end of this month, which is to see I'm a very healthy woman and I'm able to produce kids and babies for this family. And they're so eager to make sure that it's very early pregnancy for the mother. And this is a sign that the husband, in culture wise, he's strong enough to have to bring his productivity to the family. So most of the mistakes happens is just like that early plan and early urgency for getting this baby, forgetting the fact that I need to know if I'm really healthy wise ready to have this baby or not, and it will really affect my babies later on after delivery or even the breastfeeding. So we need to educate the couples. And I know in the UAE and most of the Gulf areas, they still have very good initiatives, which they do some courses or like pre-marriage courses. So we need to involve also healthy aspects in that, to make sure that they have to have the healthy topics and healthy, let's say, objectives to think while they're preparing for marriage, because that will also help them to have a healthy start and also be able to carry that baby in a healthy surrounding, or let's say healthy woman who's carrying that baby. Now, again, it's another pressure when we said we keep a woman in, unfortunately, in some of the cultures, we keep a woman under the microscope, that she's the only person who's assigned that this family will have a baby. So they think if any lack of or any delay in pregnancy, it is a mother, or let's say the wife's deficiency. It's not the husband. And again, I said that in Arabic in my live session before. For any family planning or any pregnancy, both couples should be investigated for any investigation or whatever. I know some of the topics will be related, or investigations will be specifying the woman itself. But again, we will not have to neglect the father or the husband part, when he needs to be healthy as well, and he needs to do his checkups to me that he makes enough, let's say, chances for the woman to conceive. Now, another also delay the pregnancies in some countries for months. But some of them, they have a plan of, let's say, delaying it because I'm studying or I'm working. And that is another factor where the couple started to say, okay, let me take some pills or control my pregnancy for some time before I get the first baby. Either she's working in a new company where she's not allowed to have baby for the first 6 months or whatever, 9 months. So that will be not allowed in many of the companies, because she will be in the probation period, or she has to cover whatever in the HR law policies, or because she's still a student, or she's still doing her whatever studies. So that could be somehow a healthy ways of thinking, which is a very good thing, which I will say it on the next slide, is to know your surroundings, to know your circumstances, and to know your conditions before planning that. But the very important thing is to go to the natural way of breaking that space and making enough space to have the first baby. Not to take any pills and not to take any medications before getting back to OB/GYN doctors and plan this. And the best thing is to have a natural way of, controlling your pregnancy, and you can discuss it in details with the doctor and the alternatives, which is a woman's side or the husband's side. In both cases, also the family, either the family, the small new couples or or the extended families, they don't really get the importance of having a thinking of the healthy wise of this new married couples in regards of making family. They always just think of the fancy of the parties and fancy of gathering after the parties, but they never put into their mind that these ladies, they have to take care of their health, food intake, or their health lifestyle, or whatever checkups or medications she needs to control. Maybe she has some medications she needs to control or whatever. Another thing is very important as part of the introduction part is the pregnancy condition, whether you're able to have it as planned or not planned. It's very important that you take care of yourself, because this will affect your fetus during the pregnancy, 9-month pregnancy, and again will affect your milk after birth. So most of the healthy lifestyle and healthy status of the woman during pregnancy will have a direct or indirect effect on the breast milk itself. It's very important also to educate the parents and those who are married or had a new marriage, is to look into the health status of the supposed, not even the, as we just said, the wife. So it's a parenting start. It's also a knowledge for both and knowledge for all the husbands and wife to learn together. So parts of my articles, actually, I had an headings in regards to each topic where you have to think more. So the more you think in how to catch this important information, and the more thing that you keep in mind before or during the second phase of pregnancy. So planning to find out what are the surroundings, or what are the conditions or circumstances, or whatever difficulties you're facing now. Let's get the scenario of the working mother. If she's a working mother, I just addressed in the introduction part, if she's a working mother, she needs to think if she's allowed to get pregnancy because she's still new or not. And she needs to make sure that is she allowed for a maternity leave or not. Is her types of work have long duties? She doesn't know if her pregnancy will have, let's say, a difficult phase that she needs a bed rest. She doesn't need to have an exhausted full duty, which is really physically getting her, pressure. We never know the first pregnancy scenario, if she would get an abortion or not. So she needs to have bed rest, or she needs to have sick leaves, or she needs to have unpaid leave. So it's very important to know if you're getting planned for pregnancy, is your working area supporting whatever emergency. We know so many ladies on the first pregnancy, she didn't know that she's doing it naturally, because she thinks it's like any culture, I will get pregnant. But unfortunately, she gets an abortion in the second, third week, or maybe even 8 weeks, and then she gets really stressed. And breaking this time of sick leave, or breaking this time of let's say the staying away from work, it pressures herself and the company or the managers. So it's very important. Another thing is we need to make sure healthy wise, if I'm ready to take care of this baby, maybe I have a medical condition which I need to control. We'll see it on the next slides. At the same time, we need to make sure if I'm traveling to a new country, if I came to UAE or any other country, I need to know and understand the policies and the health insurance plans, or whatever the paid plans or the packages. What are the routines of checkups? What are the routines like in government? Some hospital governments, we used to, like when I used to work in DHA Dubai Hospital, we used to have all the antenatal checkups in the hospital itself. Like near the time I resigned or left there, what happened? We started to have a planning that all the pre-checkups and the antenatal checkups to go to the peripheral clinic. So now most of the ladies who wants to have birth in government hospital, I know there's some changes again after that, but I'm just giving you a quick scenario that rather than going to the hospital itself for the antenatal checkups, you have to go for the peripheral clinics, and after that, near to the whatever trimester they plan in the hospital, you will be booked to the hospital doctors. So that will make a control for the hospital settings, you don't have an overload of, pregnancy checkups, which is treating the last stage rather than the early stage, which could be screened and monitored in the peripheral clinics. So you need to know, and again, the payment packages, am I able to have the payment antenatal packages or the planned packages? Or sometimes I will not take a package and have to do a payment for each visit, and how much I can do that, and how safe I can skip actually some of the investigations, or let's say the checkup. So it's very important to know your current situation before that. So many mothers have lost their babies because of their work scenarios, or they lost even their babies because of the condition of the planning of the investigations, or the packages were not really prepared well financially, so she couldn't help to protect herself. Now, comparing to a very poor countries where many of the preterm babies happened, or even medical losses for the mother or the baby fetus happens because they lack of having the free, or let's say scheduled access to the hospitals, and again that was affecting her pregnancy, and she might die, or the baby could die, or whatever the reason, in the very poor countries. So it's very important to know and how many visits you're able, what are the visits you're planning to skip or no financially, if you're secured or not, and also the packages of the insurance. And again, the financial ability is very important, as I just addressed. And do you have a family member who can support you? Now, many of them, they come to the UAE or any other country, and they're still in the first phase of like orienting themselves to the country. So even the policies of bringing your family, the policies of bringing your, family, cousins, or whatever to help you. So you need to know, are you planning to get a family member to help you? You want to hire a healthcare attendee or a nanny or a housemaid, whatever, or you have to have, unfortunately, some of them put the babies very early to nurseries, but hopefully we get a very good nurseries in between. Now, in some cases where the pregnancy, as I just addressed, is really difficult, what happens actually in the difficult scenarios, as we said, if I got a couple who have just married, we never know this lady is going to have a miscarriage or abortion later on, whatever types, and the numbers of weeks are very differentiate them. But the point is, I never know that I'm really able to carry this baby for 9 months. And then the stress comes again, and the level of knowledge also affected by the culture. Maybe she's doing something bad for the baby, she's not eating well, or maybe because she's not a very good lady, she doesn't know how to have, taking care of her pregnancy. Some culture, myth come into that. Well, the more of the guilty feelings on this woman. So we need to make sure that even if she gets a miscarriage or abortion, it's not her to be blamed. Again, we need to put an eye of pre-pregnancy, just as, let's say, it doesn't really prevent it 100%, but it will give us an eye that I have a healthy time to prepare myself, and a healthy time also to prepare my body to carry this baby, rather than getting the baby and then I started to investigate, I have a deficiency and so, or I have a medical problem. Okay, so it's very important to keep this in mind. And how does it really affect your breastfeeding, which is still another scenario? As we just said, if I really take care of myself, I'll be able to take care of my baby, which means I will carry a healthy baby for the 9 months, and that will affect my direct breastfeeding, skin to skin, taking care of my baby soon after birth. Now, in case if I'm not taking care of whatever the scenario of my pregnancy or pre-pregnancy, I might get some problems after delivery, I might get some high BPs or blood pressure, or sometimes you might get also bleedings, which whatever could be prevented during pregnancy. So it's very important that you take care of yourself, so you'll be able to take care of the baby. Your milk production will not be affected after birth because of the scenario of the medical condition. We know that the oxytocin level is naturally produced during pregnancy with less interruption of medical, let's say, routines, or if it's more of natural birth, which is the best. So the oxytocin will be affected by your body situation, if it's medicated or not medicated, or even the medical condition of yourself during pregnancy and during labor. So it's very important that your oxytocin level will be at the peak enough to produce and help to release the milk during the early stages of your breastfeeding. Another important thing is just to keep in mind is just, one second, did we have more attendee? I need to know which cultures do we have more than the Lebanese and Indian, South African, Canadian, and Filipino and UAE. Did we get any, and Belgium, and did we get any other attendee who are from the Mediterranean part or Arabic culture? Okay, now another thing is just Sirin, thanks a lot. Okay, now I need to ask other attendee, and when do you see the doctor actually? Usually in our cultures, I'm talking about my culture, they see the doctor maybe the first visit after I get my period missed, right? When you miss your period, you visit the doctor. Let's see the Canadian. Yusriya, when do you visit the doctor if you want to plan a pregnancy? As a Canadian citizen, not as a Lebanese. We'll see the differences now. Okay, Yusriya, when can you see? Okay, I'm Indian living in South Africa. I'll get back to you, Sumaya. Thank you very much. So, Yusriya, if you want to chat, write in the chat box, please, if you can. When do you think that we can see the doctor if I want to plan for pregnancy? Since you're covering two cultures, if you want to help me in that. And if you want to answer also, Sumaya, can you answer since you're managing two cultures, Indian culture and South African culture? Can you answer this, please? I need to know when do you visit the doctor and when do you see the doctor? For me, as culturally, when I miss my period, I will visit the doctor, as I'm talking about the Mediterranean. Okay, then 3 checkups. Let's see how what we had. Okay, in Belgium, okay, around 6 to 8 weeks first check, and then 3 checks up, 2 fetal maternal on the top of that. Okay, so you mean, let me get your name again, Julie. Yeah, Julie, you mean you do that during pregnancy, as soon as you got pregnant, right? You don't do any checkups before pregnancy. Julie, can you add something into that? Do you do any checkups of visiting the doctor before the pregnancy? Sumaya, again, it's like our culture, you're from India. So if you miss the period, you check the doctor. Okay, most of the Asians do that. Okay. Yusra, when I start my hyperemesis, okay, that is the first sign of pregnancy. Okay, Julie. Okay, Julie, when do you get the early doctor visit? Can you elaborate more? Fatma, I am a Mediterranean, but I do visit the doctor. Perfect. Thank you, Fatma. Before pregnancy to make sure body is ready. That's what is the aim, Fatma, of this lecture. Thank you. But how many of similar Fatmas do we have? How many of us think like Fatma? It's very important and really perfect that she's thinking of that, because Fatma is taking care of herself before pregnancy. So she's checking herself before pregnancy, which is the right answer, but we still lack it in the Mediterranean part by the Arabs. Yes, you can, but most people don't. Thanks, Julie. That was I wanted to know. It's not a matter of only Western country that really they master the processes and whatever they practice, but still the culture itself. So they don't do that frequent, but it is there as a practice in majority of the Western countries that the ladies should be getting a healthy checkup and investigations before the first plan of pregnancy. Then we get, okay, 6 weeks after miss period. Yes, Julie. Yes, exactly, which is the first period. So most of us, we visit the doctor after the first period, okay, or the second, third, baby, whatever period is missed. But Fatma gave the very right star answer, which is you have to check before that. Let's go to the lecture again, or the collaboration lecture. Okay, now visiting your doctor to find out the healthy condition. As I just said in the medical in the beginning of the scenario, that after marriage it's very important. I know we do the pre-testing investigation, the basic to write and sign the marriage for the Muslim, or whatever the cultures in our Arab cultures. So we do some tests before marriage, and also to make sure that we are healthy wise before getting married. I know that, but we need to make sure after the marriage itself or the honeymoon stage or whatever, you need to do a very, let's just say, comprehensive, full investigation in regards to yourself and the husband to make sure that you don't have any minerals or any deficiencies or you don't have anemia, you don't have any problems or whatever could be a sign that physically you don't see, but with the blood test you will find out later. And again, this is very important to make sure that you're carrying a baby and you're carrying a healthy baby with your healthy body. Okay, many miscarriages or many problems during our baby defect happens because of the less information they got in the medical history of the parents, exactly the mother itself or the wife. important tests will be given by the doctor to follow up. So basically, whatever the major basic tests will be given to the couples to do. But if the doctor doubted any types of deficiency from the first test, actually, she will give you another list of comprehensive tests to check your blood level, your vitamin D, your calcium, your urine, whatever, just to make sure. And hormonal checkup is very important, especially because you're planning for pregnancy. So you need to know your prolactin level, estrogen level, progesterone level, whatever hormonal female or male hormone levels in both sides. Any medical causes that can lead to mineral or vitamin deficiencies, it's very important because again it could have an effect on the growth of the baby, okay, and later on the composition of the milk, because some of the severe deficiencies will be lacking the breast milk. However, majority of your breast milk will have the natural amount and the natural, let's say, proteins or vitamins, whatever, produced in your milk. But with severe deficiencies, some also studies have found it is lacking in the breast milk if there's a severe deficiency in some of the minerals. So it's very important to keep an eye on your healthy status to make sure that you're carrying the baby, it grows healthily, and also it gets the chance for the breast composition to be good. And again, it's not a matter of even the type and the quality of milk you're producing. If you're healthy wise, you'll be able to control your pregnancy, your healthy pregnancy, and your body will be able to produce milk. Rather than fixing the deficiencies, the body will be able to concentrate on its work, which is taking care of the baby and taking care of your breast. But when you have deficiencies and you have infections or diseases, your body is trying to adjust that deficiency. So more of the attention in your body to be taken care of if you're taking the right medication or you're taking the right investigation to correct the lack or deficiencies. Again, any deficiencies during pregnancy is an important element, and we just said it could be really severe deficiency in the breast milk, which is very rare. Another discussion is the couple's medical history. I want to know from my lovely ladies, how many of you went for the doctor checkup with her husband? Did you do it yourself or did you go with your husband? And if husband were with you, did he do investigation or not? I need a full answer, please. Let me start with Fatma. Fatma, you did your own investigation for yourself. Did the husband join that investigation or did he think of the investigations? I think I have had very nice information. I'll get back to them very soon. Just one second. First visit. Yes, Fatma, if you can write down by the time I get the info. Oh, Golara from Turkey, she's talking. Thank you, Golara. Okay, I took vitamins and I did checkups before. Perfect. Golara, you're Azerbaijan, right? She's originally from Azerbaijan. She's our side. Just write your title because I will forget exactly psychologist or something like that anyhow. Okay, so she took her vitamins and she did her checkup before pregnancies, which is perfect. Originally she's from Azerbaijan and she was living with us. She was one of our active BFF volunteers and she now talking us from Turkey. Now, Yusri also, yes, perfect. You take pre-pregnancy vitamins, that's perfect, Yusria. Julie, in UAE, the checkups during pregnancy are way too much. Yes, we can discuss that again in details maybe by the end of the session if I get time, so you can open your mics. Julie, okay, what else? Folic acid. This is another important topic which I will talk now. Thank you very much, Yusriya. Folic acid. Okay, so the only time people that are trying to conceive visit the gynae when they need the fertility treatment, and then they are necessary testing for the determining if any issues. Yes, well, yes, I need if Fatma is around or any other would like to answer the same question. Wait, I think she got that. 1 second. Yeah, when I plan to conceive, I stop all the medications that I knew, skin care medications, perfect. That is part of my discussion as well. And retinol as well, because it's having very high levels of vitamin E, which could harm the baby during pregnancy. A check-up with husband. Okay, Julie did a check-up with husband. Perfect. No checks on husband himself. Ah, okay. So he joined you, but he didn't do a check-up for himself. Okay. One pregnancy with my husband and the rest alone. Okay, thank you, Fatma. Okay, I'll check-ups with my husband. Thank you, Sumaya. They visit, okay, he didn't visit the medicine doctor unless there's something and indicates him to attend with me. Yes, okay. Folic acid. Okay. Thanks for this answers. Yes, two things I'll need to talk about is the folic acid. Okay. It's very important to plan for Okay, I'm here again. Sorry for the technical issue. I hope everyone is there. Okay. So what we were just talking about is the folic acid, and also we were talking about it's very important to have the husband and the wife getting checkups on the first pregnancy. That will help me or the husband itself and myself to know if everything is okay with no issues of being delayed in pregnancy or even having any deficiencies in the woman or what even things that the husband will have to fix in himself medically as well. Now, another thing you need to keep in mind is some of the medical health problems which could have in the mother or in the husband or father itself, either the first pregnancy, if they're new couples, or they have other babies later on. So it's very important to know their medical history. Why do you think the medical history would really affect the pregnancy and breastfeeding itself? Can anyone help in that? Why do you think if medical history of myself and the husband, how does it really affect my pregnancy and my breastfeeding? The medical health of the couples. Who wants to help? If I got a medical concern or my husband gets a medical concern, how could it really happen to affect my pregnancy? Let's see in more details. If any of the couples had any medical problems, it would really affect. Thank you very much. Thank you. Okay, let's see what was the answer. Sana here, can you please touch on top of the topic? Yes, yeah, the screen. Okay. The healthy factors of would have affect the baby. Okay, there's expected mother on the first trimester, how her health and another factors will really affect her rest and affect the breastfeeding. Thank you very much. Okay. About the hormones problems, yes, Golara, that is a very good answer. Yeah, the hormones problems, if I have a hormonal problems in myself or the husband, we need to correct these hormonal things because this will affect the fertility plan to have a baby, either the mother or the father or whatever. It's very important. Even if you get a medical history of a diabetic history or hypertension or anemia or thalassemia, whatever, it's very important to carry on your doctor checkups before planning for pregnancy. Why? Because one of the answers we're taking care, I stop all medications before getting pregnancy if I'm planning, or as soon as I got the pregnancy test as positive, I have to stop all medications. But we prefer that you do that before you are tested positive because we don't want to hurt the fetus if I'm really getting a natural pregnancy. So what happens is very important to check my medical checkup, my husband's medical checkup, if there any thing that really affects me to have the baby or not. If I'm taking medication, I need to stop it before pregnancy and also make sure that it is corrected during pregnancy if needed to continue it or not. Seeing the doctor and discussing the condition is essential to ensure healthy pregnancy and also will lessen your natural chances of having any miscarriages. So what happens, we said in the well-developed countries, and we're lucky that we have, social media, we have packages, we have insurance plans, but as I just said in the beginning, in the poor countries with very limited resources for gynae or maternity checkups and even pre-test checkups for the pregnancy or during pregnancy, because of the less of chances of this medical attention, many mothers have been lost their lives because of the pregnancy were not checked because she had high BP or bleeding or any difficulties during pregnancy and also after birth. At the same time, she might have an early miscarriage or sometimes she has a premature baby because she didn't get the chance to have early detecting of her medical condition. It's very important, and maybe unfortunately for many scenarios, because they don't know about this information that I have to stop a medication, I don't have to take a Panadol, even the very less affected medications. It's very important to not to take any medications before the doctors prescribe it under precaution. Many of the babies were born with deficiency or whatever anomalies or even death because of the misuse of medications. Another thing we need to keep in mind is some diseases may affect the lactation and may also be inherited in the fetus during the mother's pregnancy stages. Some of the genetic, let's say, medical history would be carried to the baby because of the genetic carrier person of a mother or the couple or joined together. So you could be a thalassemia carrier with a normal person, or you would be a thalassemia carrier with another thalassemia carrier, and then the baby will be thalassemia also. So this is just a quick example, but many genetic problems will raise on if I don't have to detect carefully the level of my health and family history of myself and the level of the family history of my husband and himself. So it's very important to know if you're a genetic or medical problem as a carrier or even a partial, whatever the second let's say expected scenario in the baby who will be born or even will be carried. So it's very important to keep this in mind. Another important thing, which I keep it as a joke in many of my live sessions, and I joined it one of my friends, is the healthy lifestyle and the healthy food. I would like to ask all my attendee. Before asking all my attendee, I would just be again apologizing for the technical issue of the internet, but there's an evaluation form. Please fill it by the end of the session, just to keep any suggestions for improvement or any suggestions for new topics if you would like to join with BFF. So again, I need to ask, when do you start eat healthy? Before pregnancy or during pregnancy or even after pregnancy? When do you start eat healthy? When do you start eat healthy? Is that before pregnancy? Should be before, but you didn't answer me, Julie. Did you do that before or during? Sana, during pregnancy, okay. Sadaf, always eat healthy before and after. Perfect. I love that, Sadaf. Great. Julie, yes, let's see. I want to get back to Julie's answer. Yes, we know we're trying to get pregnant. Okay, perfect. So you did prepare yourself in a healthy way. So you prepared yourself, Julie. Thank you. Okay, and Tasneem, during pregnancy. So most of the Asian people, even my Mediterranean, will do it during pregnancy. Okay, I should be before, but I only eat healthy while I'm pregnant and during pregnancy. Okay, so that is the majority, unfortunately. The right habit is to eat healthy before that. And it's not just because of pregnancy, it's the lifestyle itself. I need to eat healthy and to have a healthy environment before even getting married. So it's just a habit that you need to improve your lifestyle before marriage and during pregnancy and after that, okay? But the funny scenario here, there's two funny scenarios. Either it's me eating healthy during pregnancy because I'm carrying the new baby, boy or girl in my family, and everyone will bring very nice stuff of food. Even the organic, now everyone is marketing organic, which is very good and healthy. All the organic stuff will only come during pregnancy and after pregnancy, not before that. Okay, so healthy food, organic, whatever, avoiding caffeines or tea or shisha or smoking, only during pregnancy. The other funny part, I usually join it with the husbands will bring the very rich, nice food. Even the fruits which were never been done in the daily routine. He will bring it just to make sure that he has a very healthy pregnancy scenario or whatever phase for his wife. So he will never think about healthy food only when he knows that his wife is pregnant. So he will always bring the normal routine food, but the very healthy food and iron-rich juices, many smoothies, many juices, bring all nice vegetables and all nice fruits, even which is a habit, but they make it more during the pregnancy, which is very important that you carry this habit before and after. The same thing carries on your breastfeeding, because the more you eat healthy with a well-balanced diet, which is whatever proteins, vitamins, and carbs, whatever, it will help to have a very healthy diet and plus also the healthy pregnancy and breastfeeding. So again, it's very important to have a healthy lifestyle. Okay, now the last two slides, and then we can get an interaction question and answer, because it's more of like, bringing and brainstorming what are the factors culturally or even scientifically will affect me before pregnancy. We just said in the beginning, the plan or how urgently you plan for pregnancy or how late you do that, and why do you make sure that it is very important to control with the doctor's checkups. You should control your medications, stop your medications, or even ask the doctor for any adjusted doses before pregnancy. Like if you're getting a diabetes or hypertension, does it really affect pregnancy? And after pregnancy, does it affect the breastfeeding itself or the baby? So all these scenarios will give you the best healthy start for the baby's nutrition and breastfeeding if you are able to protect it before pregnancy and during pregnancy. But if you missed that chance, many problems will arise during the pregnancy or even after birth. We said about diseases, let's say about epilepsy medications or psychiatric medications, and I think Gulara here will help in the end of the session to say something, or you can type here Gulara for the rest to read, is just, and write your title please, I keep forgetting, but it's more of psychology. Okay, so many of the psychologic medication or epilepsy or whatever very strong medication should be really stopped during pregnancy or even before that because you want to conceive, and some of the doses will be adjusted, or even I think Golara will also elaborate later, maybe some of the hormones on during pregnancy will help in improving some of the psycho problems, and especially with oxytocin level after birth, with the postpartum depressions or baby blues, whatever. But the severe diseases of psycho diseases would be taken care properly before, during, and after, where you just stop or adjust the doses based on that. Blood pressure also, it's very important. We have lost many cases of mothers during or after birth. It's just because the blood pressure was not controlled and she got lots of severe problems during pregnancy or after birth. And we just spoke about any genetic problems or thalassemia. It's very important to know if you're a carrier or not, and what is the baby type expected, and what is the checkups to follow with the baby. Does the medication or your healthy status affect you or the baby or whatever? And the other thing which we need to understand is repeated pregnancy, which is another funny topic. Well, we are starting to raise awareness between our Arab culture and Mediterranean mainly, and some of the Gulf country as well, we can say, is the very close gap, of the pregnancy. She gets pregnant soon after she gets her, let's say, period, either by the 2nd month or the 4th month or the 7th month, which is really critical for the mother. She's not able to restore her health, her minerals, her vitamins, her bleeding, her psychological level. She's still under pressure. Her, let's say, working environment also is not supporting. So it's very important to make sure that you space pregnancy and you plan it. I know some cultures will say, okay, religiously, but we're not talking about religious part, but it's naturally you need to do at least 2 years gap, which is the natural breastfeeding scenario. If you breastfeed 2 years, then you're able to do, natural spacing, or at least 18 months of whatever. But please, not to do very close, close pregnancy plans. And I don't consider this as a plan. It could be more of a mistake and lack of awareness, because the husband should be more educated about how to control himself to protect this woman, and the woman should have to learn how to protect herself naturally or taking in case medications. Again, before we said that even if you get delayed pregnancy at the first 6 months or 1 year, don't use any medications without the gynae concern. Do the natural precautions, the natural separation before you go to medication, because many of the women who didn't have the first baby and she got a medical pills or whatever to control her pregnancy so she doesn't get pregnant soon, she got infertility scenarios because we never got to know if does she has any fertility problems. So because she got pregnancy pills or whatever preventing her from getting pregnancy, she had hidden the factors that could really catch the mother's level of preceding this baby or not. So be careful of taking any medication. Prefer not to take it. Be natural. Use the natural plans the doctor will explain. Teach the husband the natural plans, and also educate them even after the pregnancy, which is after birth and having your next baby. And also the pregnancy at very young ages. We still have in our culture Even some of the Western, we have teenage, I know so many teenage pregnancies, either legal or illegal, but even in our Western country, we still have like 18, 19, 20s marriage. We still consider the 20s would be little early for some ladies who still finished her colleges. So 18, 17 to 19 and 20, it's still very early for her. So early pregnancy, also her body and her nutrition status, because most of them, they still have that teenage, scenarios where she doesn't eat very well and she's following whatever types of information from her teenage, pressures. Previous breast surgeries, or like any problems, she might get a breast cancer, one side or two. This is going to affect her pregnancy and also going to affect her breastfeeding. Did she have a breast biopsy? Did she have breast enlargement or any types of plastic surgery? Breastfeeding success rate also, and the rates of the previous breastfeeding scenarios. So how can we relate the breastfeeding scenarios and the pregnancy? Who can help in that? Childbirth educators, Dina or Julie or whoever is there, I think. What is the related between a successful breastfeeding scenario and breastfeeding effect on the next pregnancy? If I'm able to have breastfeeding scenario very good, does it affect my pregnancy plan? Or if I had a very bad breastfeeding scenario, does it affect my pregnancy plan? What do you think? Who wants to write? See, for the pregnancy plans, it's very important to keep in mind that any scenario during labor and during breastfeeding will have a psychological impact on the next baby. So if you fail to breastfeed and you have very severe difficulties, you didn't get the support, you would love to have a second baby, but you were fearing to have the second baby because you cannot breastfeed, or you don't want to breastfeed because of the scenario where really terrifying you. And also the bleeding or the cesarean sections or emergency situations and unplanned C-sections, or even interrupted medical interventions during labor, if she's not getting a natural birth, or more, more of instrumental deliveries. All these will affect her second baby plan, and she will be terrifying to get the second baby and thinking that I would love to have a second baby. My husband is forcing me, my mother is forcing me, grandmother, whatever, but I still have that fear to get the chance of the second baby because of the drama scenario during breastfeeding or even during labor and during birth. So it's very important. Carrying a bad experience, and again, Gulara will elaborate on this also if you would love to do, carrying a bad experience in any phase, in pregnancy, labor, and breastfeeding will really affect. I had faced the first baby scenario with difficulty of C-sections and emergency C-section, but because of the very bad treatment by the doctor, I wanted to get the second baby, but I was crying to that second doctor, who I've changed for sure. I used to go for each checkup crying and begging the doctor, I don't want to suffer like the first time. And that fear carried me even for the tooth extraction. I couldn't really bear to have a tooth extraction because I still feared the scenario in the operation with the emergency and the bad way that the doctor treated me. So phobia or any drama scenarios will really affect your decision for the second baby or second breastfeeding. Luckily, my breastfeeding scenarios were challenges but was successful, but my birth will really affect my second decision to have very soon baby or not, because of the very severe, let's say, experience, which is bad experience in the first baby. I think we covered all the topics, which again, let's just brief it very quickly and we'll have a quick interaction with the sisters. Again, welcome to the sisters who joined Breastfeeding Friends Society. Again, thank you for them to joining me as a lactation consultant, childbirth educator, and a doula and a lactation specialist volunteer at Breastfeeding Friends, where the topic was women's health before pregnancy, raising awareness that I have to take care of myself before pregnancy to make sure that I carry the baby in a healthy wise, myself is healthy, my husband is healthy, to have a healthy family. Genetically, medically, history, medications, follow-ups is very important, as very quickly recap of the topic. And how does it really affect your pregnancy on breastfeeding? Yes, it does. Either you have a very healthy baby to success breastfeeding with little challenges or minimum, or you have a difficult baby born, which any anomalies or preterms or any difficulties, you might have also challenges after birth or during your labor and during your birth or bleeding or whatever because of your healthy status. So any healthy status during pregnancy and labor will affect your oxytocin level. Your oxytocin level will also affect your breastfeeding scenario, and your milk production will be delayed or affected. Okay, Golara was adding a comment regarding psychiatric medications or whatever. Yes, psychological conditions for the mother is very important, and medication should be controlled or stopped, whatever the plan. Thank you, ladies. Who would like to write a comment in the chat box or would like to open the mic would be fine. But please don't forget to fill the evaluation form. Werda, evaluation form again, please. Thank you. So you will be filling the evaluation form. Would love to join any question or any comment. I'm happy to hear in the chat box or the voice message. Thank you again for all the cultures. We had Canadian, Mediterranean, South African, Filipino, Indian. We had myself, Palestinian and half Lebanese. We have also Syrian and UAE as well. Okay, so hope this lecture and this awareness really opens an eye before starting any first baby plans or during the next baby plans, spacing pregnancy, getting checkups, and educate parents together. Okay, thank you, Golara. Would you like to add something, Golara, in regards to pregnancy and medication or mental health and the effect during pregnancy and postpartum? If you would like to join any comment with your mic. Thank you, Julia. Thank you, everyone. Sana and Yusria, Julie, and Sadaf is there. Thank you. Sana was there.